Hello, everyone. Thank you for taking a moment to learn more about my chosen topic of hospice and palliative care. My name is Sarah Rocky, and I'm currently enrolled in the Health Information Management Associate's Degree Program at Santa Fe College under the instruction of Professor Julie Shea. Our project assignment was to choose a topic of facilities that are considered non-traditional healthcare facilities. My chosen topic was on hospice and palliative care, as I previously mentioned. In this presentation, I will discuss the following key points of my topic. We will explore what hospice is and the different setting hospice can occur. I will give some local examples of hospice facilities in Gainesville. I will review regulations that are specific to hospice and palliative care. I will explain some of the issues with reimbursement and funding issues, as well as issues with privacy and security. We'll go over the certifications and accreditations available for hospice workers, coding schemes, and medical records. Before we begin, as you're following along, pay attention and gather answers for these questions as I go over the presentation. Found from a document by the American Cancer Society states that hospice care focuses on quality rather than length of life. It provides humane and compassionate care for people in the last phases of incurable disease so that they may live as fully and comfortably as possible. Types of hospice care facilities can be found in a few different settings. While it's mentioned that hospice is not a place or an institution, rather it is a philosophy of care. Hospice can be exercised in a patient's home, an acute care hospital, a prison, or the more widely known setting of an independent freestanding hospice care center. The purpose of hospice is to provide palliative care for patients who have reached the late stages of care and treatment is no longer working in their favor. Within Gainesville surrounding area, there are at least 3 facilities for patients to be admitted for hospice care. These include Community Hospice and Palliative Care, Vitus Hospice, and Haven Hospice. Haven Hospice has been serving the community since 1979, but also serves 18 surrounding counties as well. The facility located in Gainesville, Florida, the E.T. York Hospice Care Center, became the first inpatient hospice care center at Haven Hospice. This location is a 30-bed facility and provides services such as advanced care planning, palliative care, hospice, transitions, and grief support. At this location, patients of any age can be admitted, and by Medicare standards, expected 6 months or less to live, or by Florida standards, with less than 12 months to live. Haven Hospice also provides at-home hospice care for those who qualify for those services and can live out the rest of their life in the comfort of their own home. As with many hospitals or medical centers, hospice also must follow state and federal regulations to run a facility and to stay in practice. Hospice care facilities must abide by both state and federal regulations to operate its day-to-day functions. On a federal level, hospice facilities must comply with Medicare standards and follow guidelines of when a patient can be admitted into hospice and certain benefits the patient is eligible to receive while in hospice. For instance, a patient with Medicare Part A can receive hospice care if they are receiving the care from a Medicare-certified hospice facility. Their attending physician and a hospice physician determine that they are terminally ill with a prognosis of 6 months or less to live. The patient can then benefit from services from hospice, employed physician receiving nursing care, medical equipment, physical therapy, spiritual counseling, and the list goes on. On the state level, specific to Florida, a patient admitted into hospice care must have a prognosis of 12 months or less for the sole purpose of pain control, symptom management, or respite care. According to Florida Statute Title 29, Section 400.609, it states that the service of hospice are to be carried out for the patient and the family of the patient, and that the services are to be available 24 hours a day, 7 days a week. Services available include much of the same as those in the federal level, but also include these services during the length of the terminally ill patient and during the bereavement period. For hospice, there are documentation requirements that I found through the National Hospice and Palliative Care Organization that specify the details that need to be documented and exceptions. For example, in the Conditions of Participation, Subpart 418.54, Initial and Comprehensive Assessment, I found that while entering into the patient's record, it is necessary to document if there were no changes in the condition of the patient or family needs. This must be updated minimally every 15 days or as the patient's condition requires. Under Subpart 418.56, Care Planning and Coordination of Services, it states that regarding approach to service delivery, that the needs of the patient unrelated to the terminal illness needs to be documented in the patient's chart as well, and who is addressing those needs. Among the care providers for a patient admitted to the hospice, there should also be documentation of volunteers and how they spent their time with the patient. The increasing cost of healthcare spending has also put pressure on the rising cost of affordable palliative care for patients. According to the NCBI government website, because spending on care of end of life is so high and because much of it is financed by government programs, the cost of end of life care has attracted considerable attention. The population of those needing a palliative care typically already receive Medicare due to their age, and this makes up about 70% of the dying population. While other funds come from Medicaid, veteran and defense health programs, those without insurance are likely to die in public hospitals. Particularly at Haven Hospice in Gainesville, Florida, they can rely on community donations. Currently at Haven Hospice, it costs the patient $206 per day to be cared for. Haven Hospice promotes encouraged planned giving to help those who cannot afford these benefits. Also, during our current time and living through a pandemic, evidence shows that the cost of palliative care will continue to grow within the next 10 years, and there will not be enough government funds to cover the cost of end-of-life care. In order to function and operate as a facility, each site must be fully licensed and workers have the appropriate certifications. Hospice provides services for end-of-life treatment, so while nurses and physicians in a hospital setting try to make a patient feel better, medical professionals in hospice are primarily trying to keep the patient most comfortable with minimal intervention in their last stages of life. Certification for nurses and providers for hospice and palliative care are specific to end-of-life needs. While hospice providers provide minimal medical intervention to patients, medical coding is still imperative both for payment, reimbursement, and for statistical data. Hospice still functions as a medical facility and therefore it still requires to code patient events. Hospice uses both ICD-10-CM and CPT-4 and HCPCS for coding. Since hospice is a Medicare Part A benefit, claims must be filed monthly and must be filed in date order. For CPT HCPCS coding, you won't see any procedure codes, but it is common to see a HCPCS code range from Q5001 to Q5010 that describe the type of hospice care being provided, whether in the home, in a long-term care facility, or in an inpatient hospice facility. There are other codes that can be used from the HCPCS manual, such as durable medical equipment or medication to alleviate the pain. With ICD-10-CM, coding guidelines must be followed and are important to follow up with each year to check for any changes. When coding a patient's diagnosis for a hospice encounter, it is important to list the primary diagnosis that most contributes to the terminal condition. While hospice may only have patients for a short while, records must still be kept for each patient within their own system. Medical records are the basis of all medical coding. As noted in the Regulations and Guidance State Operations Manual from CMS, hospice documentation is a prominent part of the individual's current medical records. Specific to Florida, hospice records are to be kept on file for a minimum of 6 years, or in the case of a minor, until the patient would have reached the age of majority per the Florida Senate's website. Creating a medical chart in the hospice or palliative care setting is similar to that of a traditional medical facility setting. Examples of how to create a quality, uniform medical record, including setting a policy in place that reflects both state and national standards, educating staff at the facility of how to make sure medical records are detailed per the set expectations, and continue to follow up with staff regarding knowledge on following the policy in place for documenting in a patient's record. These 3 steps will help ensure that the same attention to detail is being carried out amongst the staff to provide quality medical records. One issue that is prominent in hospice related to privacy and security is telehealth and cybersecurity. With the recent changes some facilities have implemented throughout the pandemic, telehealth services for COVID-19 have been introduced for hospice use. While the CMS has approved for more functions to be exercised during COVID-19, the concern for cyber attack through the applications used are still in question pertaining to patients' privacy. Applications typically used are Zoom, Skype, and other systems. This cyber attack could ultimately lead to data breaches within the facility, and if connected to a larger network, such as a hospital system, it could put them at risk as well. To conclude this discussion, hospice is portrayed as a facility triggered by fear, when in reality, it's just a place that's meant to be created as a safe place for a patient to die on their own with no medical intervention or as little as possible and as little as pain as possible. There are multiple services that are offered to the patient and the grieving family while in hospice, and a multitude of workers that provide different services in hospice, including nurses, providers, counselors, chaplains, volunteer workers, and so on. Although hospice carries a negative stigma by hearsay, it is important to understand what services hospice and palliative care provide to its patients. Ultimately, a patient can decide, based on the examination by the provider, if they would be better suited to live their last moments in the comfort of their own home, or if they require inpatient care. Ultimately, the goal is to make sure that the patient is in a safe, comfortable space.